Diabetes is a growing epidemic in the world, and Singapore is no exception. We now have the second highest proportion of diabetics among developed countries. Amongst diabetes sufferers, neuropathy is a major complication. Dr. Lai, what is neuropathy?
Simply put, it's gradual nerve damage throughout the body due to the cumulative long-term effects of having diabetes. The longer you've had diabetes, the more likely it is that you've developed diabetic neuropathy, especially if you've had periods of poor blood glucose control. Because early or mild neuropathy may only manifest as mild numbness, it may not be noticed by the patient right away and requires a diabetic foot screening by a healthcare professional to discover. However, the neuropathy does progressively worsen until the patient does notice more severe symptoms, such as significant numbness or loss of balance and coordination. Sometimes increased perception of pain, such as pain just from light touch on the skin. Sometimes constant tingling and insect crawling sensations, and even the sensation of burning pain.
Those last stage effects sound really terrible. I didn't know diabetes could do that.
Well, it's in fact quite common among diabetics. If the person's blood glucose control is poor, neuropathy is inevitable. It's then just a matter of luck whether the diabetic patient just gets numbness or develops the constant nerve pain sensations like tingling, needles, and burning.
If it's nerve damage, I imagine that is quite hard to treat.
Yes, that's correct. The traditional treatments are pain-relieving topical creams and long-term prescription of anticonvulsants. That's anti-seizure drugs. They can dull the nerve pain, but they don't actually heal the nerve damage. Well, you can take vitamin B supplements, that's good for nerves.
Is there any treatment that can heal nerve damage?
Of course, the blood glucose level must be stabilized to halt the long-term damage. If the patient can achieve that, then I can reverse the nerve damage to a certain extent using FSWT. That's focal shockwave. There are many different types of shockwave therapy. FSWT is the latest branch of that technology. Medical research and the experience of international medical experts have both proven that focal shockwave can regenerate nerves at the cellular level. Besides peripheral neuropathy due to diabetes, for instance, focal shockwave has also been shown to dramatically reverse chronic regional pain syndrome, carpal tunnel syndrome, and other nerve damage pains.
Regenerate the nerves damaged by diabetes? Is that a common treatment a diabetic patient can get anywhere?
Not yet. Perhaps in the future it can be widely available. Even though it is proven, currently it's still cutting-edge treatment. You need the specialized equipment and specialized skills to achieve the results. Well, that's our model, and that's how I designed this clinic. Our diabetic patients have given me feedback ranging from "I can feel it's working" to "it's amazing." So I am hopeful for the future of this treatment option for diabetics in Singapore.